Hello students, today I'll be talking on an important topic, common X-rays which we encounter in our day-to-day practice, and what is the basis or the basics of how do you read an X-ray, how it is done, and what are the important points you should always note when you're reading an X-ray. So X-ray is also called as skiagram, rogentogram, radiogram, and there are few specialized X-rays which uses contrast, so accordingly they are named. So if you want to visualize the CBD while putting some contrast into the CBD, then it is called as cholangiogram. Renal pelvis, it is called as pylogram. If you introduce a contrast medium into the fistula in ano, then it is called as fistulogram, sinogram and lupogram. For a distal bowel loop, when you have made an ileostomy for some diversion of the fecal content. So basics of X-rays. When you are having an X-ray, it can be a single film or it may be a serial films, multiple films taken over time. A X-ray can be a plain X-ray or it can be in contrast X-ray. We have given some contrast. How do you read? How do you know it's a contrast X-ray? That will be discussed in a later slides. Third is, what is the direction of the X-ray taken? Whether it is a PA view, that is posterior anterior view, or it is an AP view, that is anterior posterior view. What is the importance of taking in PA view or AP view? That I will discuss in the later slides. And the last is the position of the patient while taking the X-ray. X-ray can be taken in an erect position, supine, or a lateral position. So this is a typical way in which you take an X-ray. This is the X-ray machine. Patient is standing at some distance with the X-ray machine and then the plate. So when an X-ray machine or the X-rays go through the patient, it forms a what you call the image over this film, and this image is developed, and then you get to receive an what you call an X-ray film. So try to understand this diagram. So in this, a lady is trying to take a picture of this person who's standing in front of a tree. So when she takes a picture, what we'll see in the picture is, you'll see a person, behind him is the tree, but you are not going to see the part of the tree that is lying behind the back of the this person. So similarly, it is going to be there in the what you call the X-rays also. So the part which is exposed to the camera first will be seen, then the part that is lying behind this person is not going to be seen. So in this also, the part which is exposed to the person will be seen over the film. But as this X-rays are penetrating waves, so it penetrates the person's body, and you will have an image of the anterior part of the chest of this patient, but the image is not going to be clear or better because it will overlap. So the part which is exposed first will be appreciated better as compared to part of the body, that is the anterior part of the this person, will be seen little less. So in order to, you want to see the lung field, for example, if you want to see the lung field of this patient, as you know, heart is placed anteriorly, so you have to take a PA view. So PA view suggests the direction of the X-ray from posterior to anterior passing through the person. So this X-ray will show you the proper good lung field, and heart shadows is not going to be that better appreciated, but it will be there. In case you have a trauma, chest trauma, patient is receiving a chest trauma, you want to see the fracture of the anterior rib, so you have to rotate this patient so that the anterior part of the chest is exposed first to the X-rays, so it will cast a better shadow, and their lung is not will be what you call exposed secondarily. So you will be able to appreciate the lung field better on posterior anterior view, and you will be able to appreciate the anterior broken ribs better on AP view. Now coming to one important point when you describe an X-ray, try to understand, this is the most important slide for understanding the X-rays, how X-ray is read. So point to be described on an X-ray is important. So one is the plane or the contrast. Second is which body part does this X-ray shows, whether it's a chest, an abdomen, pelvis, or a limb. Third is you should be able to identify the normal bony anatomy that is seen with the soft tissue shadow that is seen over the X-ray. And lastly, the various types of density you need to describe. So, for an X-ray, standard X-ray, the reference point is always the bone. So, bone is the density of the bone is the reference point. It will appear white. So, you can see, you can take any bone of your body, normal body, that is clavicle. So, this is the reference point. So, any structure that is whiter than this bone is called as radiodense or radio opaque. And any structure that is less whiter, or you can say blacker than this bone, is called as radiolucent. So try to understand this. Next is jet black. Air is jet black. You could appreciate air is jet black. So you can say this is the person's chest. So this area is, there is air, there is no soft tissue, no bone. So this is jet black. So you can see this is called as jet black. So because it is an air, pure air. Next is black. Black is when you have air in small pocket, as in soft tissue is there. So this is slightly whiter than this black, because here purely there is air. Here you have small pockets of air into the lung field. So it is slightly whiter than compared to this black, where you only have the air. So this is black. So this is lung field is black. Third is gray. Gray is when you have soft tissue, depending on the density of the soft tissue. So this area is area of liver. You know, right side there is an area of liver. So you could see this is soft tissue. So it will appear whiter as compared to the lung field, because lung field is not dense. It has a small air loculi, whereas your lung liver is totally solid. So it will cast a whiter shadow as compared to the lung, and slightly less dense or less wide than the bone, because bone is the most dense organ. Next is something that is denser or whiter than the bone. Can be one as contrast. You have given some contrast. Second thing, it can be a stone, radio opaque stone, as in your kidney stone. And third is it can be a metal, foreign body, or some rails to have a metal ball at the tip. So it is seen as a denser than the bone. Hope this slide is very important. Your concept is very clear. So your bone is the reference point. Anything that is less dense, less dense will be appearing slightly wide, what you call blacker than this bone, and that something that is more white than the bone is called as radiodense. It will be contrast, stone, or metal. So when you are given an X-ray, you define the X-ray or describe the X-ray in two parts. First is whether the X-ray is a plain X-ray or a contrast X-ray, whether it's an abdominal or thorax. As in case of surgery, we'll mostly have an abdominal and thorax X-rays. Then whether it's an AP view or a PV view. Lastly, soft tissue shadow. What soft tissue shadow you are able to appreciate in an X-ray. Before moving to describing an X-ray, try to understand this normal anatomy of lung. Just imagine this. So this is a typical picture of your chest. So what do you have in the chest? You have the ribs, multiple ribs. Then you have lung, right lung and the left lung. In the center of your chest, you have the heart. You have an aorta here. You have an IVC here. This is the trachea. And behind this trachea, there is what you call the esophagus. And both of the this is the right dome of the diaphragm, this is the left dome of the diaphragm. So this is a general picture. So when you are given an X-ray of the chest, you should try to imagine this normal anatomy when you are having an X-ray. Next is, this is the organ in the retroperitoneum. So you have right kidney, this is the right kidney, slightly lower as compared to the left kidney. This is are the adrenals, and these are the ureters that runs parallel to the transverse processes, and at the sacroiliac joint they slightly go out and then turn medially to enter the bladder. So these are the you can see the structure. This is the left ureter, this is the right ureter, this is the IVC, this is the aorta, this is the right common iliac, and then this is left common iliac. So this is this is the area of the bladder. So you have this is the retroperitoneal, or you can say KUB region anatomy. In gross, when you're given an X-ray of the abdomen also, you should note remember this. And third is this. So this is the abdomen of the intra-abdominal structures. So this is the liver, This is the right lobe of the liver on the right upper abdomen. This is the left lobe of the liver. Then you have the stomach. So here somewhere he has to be the fundus. This is the body. This is the antrum. So this is the normal anatomy. Next is this is the ascending colon. This is the transverse colon. This is the descending colon. And then you have a sigmoid and the rectum. And in the center you have all these small bowels. This is very important to remember when we will discuss this X-ray. So now start. So what is this X-ray body part? So this is basically a plain X-ray. Could you see anything? So could you see anything denser or whiter than the bone? Any bone you can pick up. Just I'll pick up this clavicle. Could you see anything that is whiter, much brighter than the bone? No, I could just see the number. This is digitally printed on this. So nothing I could appreciate that is denser than the bone. So it is basically a plain X-ray. When you are able to see anything that is whiter than the bone, then it will call it as a contrast X-ray. So this is the plain X-ray. Plain X-ray. Which body part you suspect? Which body part is this? This is basically the chest, because you are able to appreciate this is the right and the left clavicle. This is the ribs, multiple ribs. This is the shadow of the heart that is found, and this is the right dome and the left dome. So you describe it's a plain X-ray of chest. Whether it's an AP view or PA view. So what you see is your heart is not that well appreciated. As the heart is an anterior structure, your heart is not well appreciated. So this X-ray seems to be a PA view. The X-ray is taken from the posterior anterior view. So this is an X-ray of PO view. And what are the normal lung shadow you are able to appreciate? This has to be the right side of the, this is the lung, this is the right lung, and this is the shadow of the heart, this is the right dome and the left dome. Next, coming to the another X-ray. So now this X-ray is a plain or a contrast. You could appreciate anything that is denser. You can compare with the pelvic bone. Anything that is denser with than the bone. Yes, I could see a small this thing. So this is probably the tip of the Ryle's tube. Anything else? Yes, these letters are darker because it's digitally printed. So that is not of concern. So next, whether which body part is this? This seems to be the abdomen, because you could see the pelvis. This is the sacrum bone. This is the left ilium bone, and these are the lower ribs, 11th, 12th ribs. You could appreciate this is the spine. So this is probably in an X-ray of a abdomen. Now, whether it's an anterior view, AP view, or a PA view, you are able to appreciate this bowel in the center of the X-rays better. So this has to be an AP view. When we are not these are darker as compared to the than the kidneys. You don't see the kidneys, then it has to be a PA view. But normally this is the cases on abdominal X-ray. So you are able to appreciate the bowel better as compared to the spine. So it is an AP view. And lastly, what are the shadows you could see? Here you know there is a right sided. You have a liver. So this is the area of the liver, right lobe of the liver. Here somewhere we'll have a level of the liver, and you could see there is some air fluid level on the left dome of diaphragm. This is the fundic gas that is present in the fundus of the stomach. This is normally present in most of the patient, and when you have this level, that suggests patient the X-ray was done in an erect position. So when you have patient is in erect position, you will have this level. Otherwise, in the supine position, you don't appreciate this level. Hope this is very clear. Now, first part you have to describe in that terms. Now you have to divide whether you are dealing with a chest X-ray and a abdominal X-ray. So if you are doing a chest X-ray or dealing with a chest X-ray, describing a chest X-ray. So the part 2 in you remember A, B, C, D. So these are the 4 headings under which you describe a chest X-ray. First part was to describe whether it's a plain X-ray or what you call a contrast X-ray, chest X-ray. Then what are the normal shadows you are able to appreciate, and then the dome. So you remember this A, B, C, D. A for air bronchogram, that is the lung field. B is the bony anatomy. C is the costophrenic angle. This is the costophrenic angle, and the cardiac shadow. And fourth is the what is the status of the diaphragm. So you remember A, B, C, D. A is the air bronchogram. How is the lung field of this X-ray? B is the bony anatomy. How is the rib? Is any fracture in the rib, clavicle, and then you trace all the ribs and see for the ribs. Third is the costophrenic angle. Is there any blunting? Would see the sharp costophrenic angle. Is there any blunting? That suggests a collection of the fluid in the costophrenic angle. And what is the cardiac shadow? You could appreciate this is the right side of the right border, and this is the left border. And the lastly the diaphragm. How is the diaphragm? Is there any opacity or any radiolucency under the diaphragm or not. So one important thing, as I already told you, what is radiolucency? Radiolucency is that is something is blacker than the what you call the bone. So if you pick up this bone, so it is slightly radiolucent as compared to this bone, and something that is more white than the bone, more white than the bone, is called as radio dense or radio opaque. An example is contrast or a metal there in the patient or the stone. If you're dealing with an abdominal x-ray, so part 1 you describe in whether the plain abdominal x-ray and what are the soft tissue shadow you see. So similarly, when you have an abdominal x-ray, you describe into 4 that is similar to chest x-ray, that is A, B, C, D. So here the this thing A changes. There it was air bronchogram, here is air fluid level. Is there any air fluid level in the x-ray? What is the level or what is the position of that air fluid level, whether it's a centrally placed or placed in the laterally right sided wall or the left sided wall or superiorly. So position of the bowel or the air fluid level. C is any calcification or radio dense thing you are able to appreciate in the x-ray. It can be a stone or it can be a contrast, so it becomes a very special x-ray. And third is the position of the dome. How is the dome? Is there any radiolucency or radio opacity or in relation with the diaphragm? So A, B, C, D similar to the chest x-ray. A point to be noted is how do you differentiate or what is the meanings. You must have read x-ray QB region, x-ray abdomen. So basically what is the difference between these two x-ray? So in x-ray abdomen, it is always AP view, anterior posterior view. X-ray is taken in anterior posterior view. You will be seeing both the dome of diaphragm, as you can appreciate in this. Both dome of diaphragm should be seen properly, and pubic symphysis is not mandatory. You may not appreciate pubic symphysis in a abdominal x-ray. Whereas in an x-ray KUB region, the view is PA view, that is posterior anterior view. The x-rays are exposed from the posterior to the anterior. So and the diaphragm is not must. The lower this thing is of x-ray KUB. You may not able to appreciate the diaphragm in this x-ray, but the pubic symphysis has to be seen. You could see the pubic symphysis in this area, that has to be there. Then only you will call it as an x-ray KUB region. Hope you this point is very clear. Hope I am able to make you understand how do you read an x-ray and what is an x-ray. So let's have an exercise to try to read an x-ray. How do you read an x-ray, and accordingly you diagnose the condition. So first is try to identify whether this x-ray is a plain x-ray or a contrast x-ray. I look for the bones. These are the bones. So I don't see anything that is denser than this bone. So most probably this is a plain x-ray. Next, which body part? So this is probably the chest x-ray with part of the upper abdomen. So chest x-ray, you can, because you can see the multiple ribs. This is the clavicle, this is the heart shadow, and these are the domes of diaphragm. So this is the probably the x-ray of the chest, a plain x-ray of the chest. And what you describe this, the soft tissue shadow which are able to appreciate. So this is the soft tissue shadow of the heart. This is the lung field, right lung field, left lung field, and this is the dome of the right dome of diaphragm. This is the left dome of the diaphragm. Now coming to describing the X-ray in ABCD pattern. So A is air bronchogram. Try to appreciate the lung. C for the lung. How do you identify the lung? So you could see this reticular marking. You could see the epicete there. This is the reticular marking. You will see this fine thread-like structure that is reaching up to the lateral border of the chest wall. So this suggests there is a normal chest expanded lung. You could appreciate very fine thread-like structure. You could appreciate. So these are the lung field. Lung field appears to be normal. This thread-like structure reaching up to the lateral wall of the chest. Now B, try to identify any bony abnormality. C, trace the bones. So I could see the right clavicle. It is intact. There is no fracture. This is the left clavicle. There is intact. There is no fracture. Then these are the ribs. I am tracing the ribs. Okay, there is no fracture. Intact rib, intact rib, intact rib, intact rib. So you have B done. Bone seems to be intact or normal. So I could see the ribs. Now C, costophrenic angle. So this is costo. This is phrenic. So this is costophrenic angle. I could appreciate on the right side well, angle is very sharp. On the left side also the costophrenic angle is sharp. So there is no fluid collection. When this angle is blunted, that suggests there is some fluid collection. And the hard shadow, the cardiac shadow, I could appreciate the cardiac shadow. This is the cardiac shadow. This is the left ventricle area, the right ventricle area, and this is the area of aortic knuckle. So this is a cardiac shadow is seems to good. Next is the diaphragm. You see the diaphragm. So D, this is the diaphragm. Right sided dome of diaphragm and left sided dome of diaphragm. So you have a radiolucency over both dome of diaphragm. You could see this is the right dome of diaphragm. Below this you have a radiolucency or less white as come with the diaphragm, and then this is your liver. So there is something called as a gas under diaphragm. So this is right dome mein there is gas under diaphragm. There is also gas under the left dome of diaphragm, but this is a fundic gas that is normally present in every patient when you take an X-ray in a standing position. So this is a normal left-sided gas under the diaphragm is considered to be normal, but any gas, any amount of radiolucency below the diaphragm on the right side of diaphragm, it is called as pneumoperitoneum. So what is your diagnosis? It's an plain X-ray of the chest. We described into ABCD. It is an AP view because you are able to appreciate the heart better, more better in this. So the X-ray was taken in an AP view, and there is gas under the right dome of diaphragm. So these are the findings when you describe the chest X-ray. So what is your diagnosis now? So the diagnosis is pneumoperitoneum. So this next X-ray. So whether this X-ray is of a plane or a contrast, I don't see anything that is denser than the bone. I see this rib, I see this vertebra, so I don't think anything that is denser than the bone, except the small piece, which is probably the tip of the Ryle's tube. So it is basically a plain X-ray of abdomen because I am able to appreciate the dome of the diaphragms, the ilium bone. So this is an X-ray of abdomen, that too plain. Now we'll describe this whether it's an erect or an supine X-ray. So as it is already written, there is an erect, so it is an erect X-ray. But when you have an air fluid level, as in use horizontal lines, that suggests this X-ray was taken in an erect position. Now we'll describe this X-ray in our ABCD format. So A is air fluid level. So are you able to appreciate any air fluid level? Yes, I can appreciate this is an air fluid level here, 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 and here, here, and here. So these are air fluid level. Air fluid level means above this level you have air and below this level there is fluid. So this is air fluid level, and it is showing some sort of pattern, that is step ladder pattern. One is here, then is the next step, then you have third step down, then again the step, and this is called as typically a step ladder pattern that is seen in a distal ileal obstruction. So B is bowel position. Which air fluid level in which position do you see? It is mostly in the center of the abdomen, not on the right lateral wall or on the left lateral wall. That are the places where you have a large bowel. So it is in the center of the abdomen. So probably this is the small bowel air fluid level. Then C, do you see any calcification or a contrast? No, calcification and contrast are seen whiter than the bone. So I don't see any calcification, obvious calcification except this, and no increased contrast. Next is D. Are you able to appreciate the dome of diaphragm? Yes, I could see this right dome of diaphragm. This is the left dome of diaphragm. Right dome of diaphragm, there is no radiolucency below the right dome of diaphragm. There is a radiolucency over the left dome of diaphragm. That is the normal fundic gas that is normally present. So let us revise. So it's a plain X-ray of abdomen, EP view, or it described ABCD. In ABCD, it shows multiple air fluid level and step ladder pattern. This is typically seen in what you call small bowel obstruction. Next X-ray, similar X-ray. Are you able to appreciate? This is a plain X-ray or a contrast. This is a plain X-ray. Plain X-ray of the abdomen. Yes, I could appreciate the iliac bone. I could appreciate the pubic symphysis. Yes, this is an X-ray of KUB region or abdominal X-ray. This seems to be a KUB region because you are able to appreciate the pubic symphysis, but this thing is dome of the diaphragm is not visible. Okay, next is next is next is are you able to see the air fluid level? Not really. I don't see an air fluid level, but I'm able to see a centrally abdominal placed a large dilated bowel loop. This is the large dilated. This is the caliper. This is the diameter of the large dilatation. You could see one. This is two. So this is the bowel loop. One loop of bowel. So entire bowel loop is this is the entire bowel loop. You could appreciate. You could appreciate any calcification in this X-rays. No, I am not able to appreciate any calcification. So there is no stone or no what you call the contrast given. Then we have D. Are you able to appreciate the dome of the diaphragm? No, it is not able to appreciate. So, but the problem is in this X-ray. This is the X-ray of a child because you could see the epiphysis. That this is not fused. This is X-ray of child. So that it was not adequately taken. Ideally, you should have both dome of diaphragm. This is not well taken. But I could appreciate a centrally placed, a large dilated bowel loop that is going over the left dome of diaphragm, and it is forming an ohm. This is called as ohm or called as coffee bean. It look like a coffee bean. So this is a coffee bean sign or ohm sign that is typically seen in a case of sigmoid valvulus. So this is the child, basically X-ray of a child having a coffee bean appearance or a ohm sign suggestive of sigmoid valvulus. Next X-ray. So what is this X-ray? It's a plain or a contrast X-ray. Yes, you are right. This is a plain X-ray of chest because I could appreciate the ribs, and this is the clavicle, right and left clavicle. This is the dome of the diaphragm. AP view or PA view? Most probably this is the PA view X-ray because I could appreciate less. The heart is not properly seen. I would appreciate this. See now. Coming to the part 2, so we describe into ABCD. A is air bronchogram. Yes, I could appreciate the air bronchogram. This is the reticular marking that is reaching up to the lateral wall of the chest. So I could appreciate. So this the right lung field seems to be clear. Whereas we'll see on the left side, could you appreciate? Compare this right with the left. Could you appreciate any air bronchogram or reticular lines going up to the lateral wall of the abdomen? No, I could not see. This is a homogeneously radiolucent area. You would not appreciate this. So this suggests there is a air inside the left side of the chest, purely chest. Okay. Now the bony, and you see any bony problem, and you see you trace the ribs. So this ribs clavicle seems to be okay. This is also okay. Then these are the ribs. I could trace the ribs. Okay, rib, there is no fracture, no breach in the continuity of the ribs. I could not appreciate any. You could see this. This is basically the costochondral junction because your cartilage is not radio opaque. It is radiolucent. So that's why you're not able to. You could appreciate this part is not visible beyond this. But this is the costochondral junction. This is basically B. The bony cage appears to be normal to me. Then the C. Costophrenic angle is. So this right costophrenic angle appears to be normal to me. This is sharp and clear, whereas the left costophrenic angle, even this is also sharp and clear. Now comes the cardiac shadow, heart. You could appreciate the heart shadow. This is the right ventricle of the right atrium and ventricle of the patient. This is the left-sided heart. Whatever heart you see, it seems to be okay to me. Next, the dome. You could appreciate this is the right dome of the diaphragm. There is no radiolucency under the right dome of diaphragm, and this is the left dome of diaphragm. There is no radiolucency under the diaphragm, so this is okay. So what is your diagnosis? This is homogeneous opacity that is seen over the left side as compared to the right side. So most probably this is the case of tension pneumothorax, or simply you can call it as a pneumothorax. So it's a plain X-ray of chest, AP view, air bronchogram, Bony anatomy seems to be normal. CP angle and cardiac shadow seems to be normal, and the diaphragm seems to be normal. So this is an X-ray of a patient with a pneumothorax. It can be a traumatic pneumothorax, but you are not able to appreciate any fracture of the rib, or it can be a spontaneous pneumothorax. Patient is a chronic smoker, or patient had a ruptured bulla that may present to you with a pneumothorax. Next X-ray is this. So what this is a plain X-ray of the chest. You could appreciate this is the X-ray of the chest. Then is an AP view or a PA view. I'm able to appreciate the heart little better as compared to the previous X-ray. So it is basically an AP view X-ray. Then next is soft tissue shadow. You could appreciate the heart shadow. This is the shadow of the trachea. You could appreciate. So now describe into an ABCD format. So ABCD, A is air bronchogram. You could appreciate a reticular lining on the right side, but it is not reaching up to the lateral wall of the chest in the side, right side you could note. Whereas on the left side you could see the reticular marking, but you could appreciate reaching up to the chest, up to the lateral wall of the chest. Here you could appreciate it ends somewhere here, and you could see a razor sharp margin. You could appreciate this, and this is more of homogeneous. This part appears more of homogeneous radiolucent area as compared to this. So this is basically the collapsed lung. This is the lung, partially expanded lung, and this is the pneumothorax. And one more important thing we're able to appreciate is the air fluid level. Above this is air, and below this there is fluid. So we form a horizontal line. This horizontal line suggests there is some air above this, and here and below there is some liquid fluid. So in the previous X-ray there was no such air fluid level, so it was a purely a pneumothorax. So this forms a hydropneumothorax on the right side. Hydro, it can be blood, then called as a hemopneumothorax. It can be a purely a fluid because pleural fluid, we call it as a hydrothorax, or it can be because of pus, so it can be pneumothorax. So it's a plain X-ray of chest, AP view. We have described into ABCD, air fluid level, and there is loss of bronchoalveolar marking on the right side. So this is the case of hemopneumothorax. If the patient gives you a history of trauma, if there is a history of trauma, then you call it as a hemopneumothorax. If there is no history, you can call it as a hydrothorax. Hydrothorax, it can be a pus, it can be blood, it can be simple fluid also. Next X-ray is this. So which X-ray is this? You could say this is an X-ray or a plain X-ray or a contrast X-ray. It is a plain X-ray, but there is something that is radio dense. You could appreciate a figure of 8 type of material over the anterior part of the chest. This is basically patient might have an open heart surgery. These are the steel wire that has been used to close the sternum, the bone. So you could appreciate this. This is an ECG lead you could appreciate. So that is keep it aside. This is basically a plain X-ray of chest, probably chest. You could should appreciate the heart shadow, you could appreciate the lung shadow. So we'll start with ABCD. A is you could appreciate the air bronchogram on the right side, but there is some radio opacity over the right lower part of the lung field. So keep this in mind. Whereas the left lung field appears to be normal, you could appreciate the left costophrenic angle. B, bony, you could appreciate, you check the for the right clavicle, left clavicle seems to be okay. Then the rib seems to be okay to me. Okay, rib seems to be okay to me. You could appreciate the heart better. Those probably maybe a AP view of the chest. And cost of C, that is the costophrenic angle. I'm not able to appreciate the right costophrenic angle. This is blunted because of the presence of radio opacity on the right lower part of the chest, whereas the left is already better seen. And your diaphragm, I'm not able to well appreciate the right dome of diaphragm, and left dome of diaphragm is seen quite well. So any radiolucency or blunting of this what do you call the radio opacity on the right costophrenic angle suggests there is some fluid collection. So this is a fluid collection that is present inside the chest. You don't see a horizontal level that suggests there is no pneumo component or air component in the chest. This is purely an fluid component, and it is forming a pattern of S or lazy S. This is called as Ellis's S curve, and it denotes basically the collection of fluid into the peritoneal cavity. So you must be wondering why you have an ellipsis curve, why it is not a flat line seen as a horizontal line when you have a fluid. So the explanation here is basically what happens. This try to understand this picture. So this thing, it denotes your pleural space. So whenever there is a fluid, it will mostly gravitate towards the lower part. So more fluid will have in the base. So the thickness of the fluid collected, it will be more at the base. And as the fluid increases, this peak will rise slowly rise. So it will form a thick structure, or thickness will be highest at the base, whereas slowly as the amount of fluid increases, it will this peak will rise, but it will be thinner as compared to the base. So it will give you such a picture, or this is the fluid that is present into the pleural cavity. So when you pass an x-ray, through this fluid from anterior posteriorly, what happens? First the x-ray has to go from here, it will be pass through this, and again posteriorly it will pass. So it will form a thick dense shadow. But here as the layer of the this thing is very thin, with this fluid is thin, so it will not cause that dense shadow. So the dense shadow is not going to be there on the lateral side. So you will have an S-shaped curve because of the less denser or a less thickness of the fluid that is present in this area. The more prominent, the more denser area will be this, because the thickness of fluid that is present in this area is more as compared to here, because it is a very thin and the fluid is started accumulating, and when this rises, the thickness of this will also increase, and here it will become less thicker, it will be thin, so you will have a less dense shadow as compared to the lower down. So this will form a ellipsis S curve because of the effusion, if there is purely clear fluid present that is in the pleural cavity. Next X-ray, try to appreciate this X-ray. So what is this X-ray? Is it a plain X-ray or a contrast X-ray? So I could appreciate this is the ribs or the vertebrae, and there is something that is denser than the, or whiter than the rib or the bone. So it is basically a contrast X-ray. Now which body part? I am able to appreciate the lower part of the rib. This is the dome I could appreciate. So most probably this is a X-ray of the abdomen. Next, AP view or a PA view. This is probably an AP view. Now it's an but I could appreciate one important peculiarity is it is something giving me a tree-like pattern. You could see the branch. This is the stump of the tree, and you have a branching pattern. You could appreciate, and it is present over the right side of the upper abdomen of the patient. So what is the structure that forms a tree-like pattern on the right upper abdomen? So it is biliary tree. That is, so what structure is there in the right upper abdomen? That is the biliary tree. So this is the case of, or the X-ray of T-tube cholangiogram. You could see this is T-tube inserted into the CBD. So you could appreciate. This is your right side of the right hepatic duct. This is the left hepatic duct that is not well ossified. This is the common hepatic duct, and the common hepatic duct, it is going into the ampulla, and through ampulla this is the spillage of the contrast into the duodenum. So this is the C shape of duodenum. So it's a case of basically so you could see this is basically a contrast X-ray, because there is some dye that is appreciated well into the that is denser than the bone. Then it is an abdomen, because I could appreciate the ribs and lower part of the ribs and the spine. It is a PA view. It's a PA view because taken from posteriorly, because your what you call the CBDs are all mostly the posterior structure, though they are intraperitoneal, but it's slightly posterior, and you can appreciate a tree-like pattern in the right upper quadrant of the abdomen. So it's a T-tube cholangiogram. You can correlate with this diagram. This is the normal diagram of the T-tube. It's a T-tube cholangiogram. So what is this X-ray? Is this a plain X-ray or a contrast? You could see something that is denser than the bone. This is the contrast X-ray. Which body part? I could appreciate the pelvic bone. So you could appreciate the biology. This is the pubic symphysis. This is the head of the femur. So this is the X-ray of pelvic area. So what you see? I see a tubular structure, a tubular contrast that is reaching up to the pubic symphysis level. So most probably it is a X-ray of RGU MCU. So it's a retrograde urethrogram. You have injected the contrast through the external meatus that reaches up to the bulbar urethra and just short of the sphincter. So this is a RGU part of the RGU MCU X-ray. So this is what you see. This is a contrast or a plane. This contrast X-ray, because you could appreciate something denser than the bone. So which body part? This is mostly the pelvis. This you can see the what you call the ilium bone and the pubic symphysis, and there is something that is the radio opaque lesion is basically at the pubic symphysis, round enough with this thing. So this is basically a micturating cystourethrogram. Micturating because he just had started just micturating. So you could appreciate this is the bladder, this is the bladder neck, this is the membranous urethra. You can see the sponge, this radiolucency, slight radiolucency, that is the sphincter, and this is started ossifying your bulbar urethra. So this is a micturating cystourethrogram. So normally we do a RGU MCU together. RGU is done to study the anterior urethra, that is urethra that is distal to the what you call the sphincter, and MCU, that is micturating cystourethrogram, you do for the bladder and the posterior urethra, that is the posterior what you call the prostatic urethra. Next X-ray. So this X-ray, what does this X-ray shows? So this X-ray, which body part? Is it a plain X-ray or a contrast X-ray? Yes, I could see something that is starting at the neck region and going into the abdomen, radiolucency. So this is a contrast X-ray of the chest. It's a specialized X-ray, and you also have a lateral view also of this X-ray. So what is the structure that starts at the neck, the oral cavity, and goes up to the abdomen? That is the esophagus. So this is an X-ray with a contrast of the chest with a tubular organ that extends from the neck to the abdomen. So this is probably the X-ray of a barium swallow. Barium is given per orally, and then we have to take the X-ray to study the characteristics of the esophagus. So what is this X-ray? Is this a single X-ray? No, this is not single. This is contrast X-ray. First of all, it's a contrast X-ray. You could see the radio opaque shadows denser than the bone. So this is a contrast X-ray, or you can call it as a serial X-ray taken over time. What is as it ossify? You could see the contrast into this part, that is the esophagus. Then it reaches the stomach, and then it reaches the small intestine. So this is basically a barium meal. So you have given some barium per orally, taken X-ray taken in the esophagus. Then over time the X-ray was repeated, that goes into the stomach. Then it ossifies the small bowel, and accordingly entire small bowel, and then it is excreted into the rectum. So this is basically a barium meal. So the next X-ray, this is basically contrast X-ray of the abdomen, because I am able to appreciate the ilium bone here, and most probably an APU. So what X-ray is this? This is basically an abdomen contrast X-ray. So we'll describe in ABCD. Are you able to appreciate any air fluid level? No, there is no air fluid level. I could not appreciate. There is bowel position. I am able to appreciate the bowel on the lateral wall of the right side. This is appears to be the transverse colon, and you could appreciate the descending colon, and this is the sigmoid. So this is a contrast X-ray visualizing the colon. You would appreciate this is called as the hostration. These are the hostrations. These are incomplete. They never cross the full wall from here to here. They are incomplete. So it will end up somewhere here. So this is not complete. This is immature. So this is even similar X-rays. We have the similar X-rays also. This is the ascending colon. This is the transverse colon, and this is the descending colon. In this descending colon, you could appreciate the change in this texture of the transverse and ascending colon as compared to the descending colon. You could see it is almost straight. It has lost the hostrations. So it's a typical feature of a ulcerative colitis. Patient is having a left-sided ulcerative colitis. So this is basically a X-ray of a barium enema. The clinical diagnosis is basically this is a loss of hostration because of ulcerative colitis of the left side of the colon. Next, this X-ray. So it's a plain X-ray or a contrast X-ray. Yes, I could see something black was sorry whiter than the bone. This is contrast. This is contrast. So this is first is it is not a plain X-ray. It's a contrast X-ray. Plus it is not single X-ray. These X-rays are taken over time. 1, 2, 3, 4, 5, 6. So it's a serial contrast X-ray of the abdomen. Because I'm not able to use the abdomen because I'm able to appreciate the ilium bone and able to appreciate the ribs also and the vertebra. So this is an contrast serial X-ray of the abdomen showing the radio opaque shadow on the right side. Then this shadow forms the bowel, that is the ascending colon, and is giving a picture of a transverse colon, then the descending colon. Similarly, as the contrast moves forward, you are able to appreciate the distal structure. This is the area of the sigmoid and the rectum. So it's basically a visualization of the entire colon, but the contrast goes from the some small bowel towards the rectum, whereas in the previous X-ray the contrast was given per rectally, so it is called as barium enema. Here it is given through some opening, that is mostly a ileostomy, some stoma that is made of the previous surgery. To visualize this distal part, we do something called as lupogram. So this is a serial X-ray, contrast X-ray of the abdomen with some tubular structure that suggests it's a large bowel, not a small bowel, because it is occupying the lateral part of your abdomen and the upper part of the abdomen. So it is a lupogram. What is the indication of doing a lupogram? When you have a previous surgery, laparotomy, and you have made a ileostomy for some reason, then you need to visualize the distal part of the bowel, whether is there any what you call a stricture, or is there any leak, or any what you call any breach in the mucosa of the rest of the bowel, whether the contrast is going distally or not, before closing the stoma. So next X-ray, what is this X-ray? Is a plain X-ray or a contrast X-ray? Remember one thing, what I have told you already. If there is something that is whiter than the bone, either it can be a contrast, it can be a stone, or it can be a metal. So in this case, this is a renal stone because it gives a picture of the kidney. So this is the staghorn calculi. So there is radio density, so it does not mean it's a contrast X-ray. It can be contrast, it can be a what you call the stone, there is some stone, or a metallic structure, some metal. So this is a plain X-ray of KUB region because you are able to see the pubic symphysis. You're not able to see the dome of the diaphragm. So this is a X-ray KUB region showing radio density on both side of the abdomen, right side as well as the left side. So this is A. Are you able to appreciate the bowel? Yes, you can appreciate a little bowel. This is the colon, right sided colon of the patient. You could appreciate. Now, could you appreciate any radio calcification? Yes, I could see radio density that is present over the right side of the abdomen that forms the kidney, plus this is the pelvis, and this is forms the upper part of the ureter. Similarly, a smaller radio density that is appreciated. So this is the calyx. You could appreciate this is calyx, and this is another calyx. This is another calyx forming. This is the pelvis, and this is the upper part of the ureter or PUJ. So these are bilateral staghorn calculi. You could appreciate some radio density over the left lower abdomen of the patient. This is corresponding to the lower part of the ureter. So how do you describe ureter on X-ray? So ureter that is above the superior sacroiliac joint is called as upper ureter. Ureter between the two sacroiliac joint here and here, it is called as the middle ureter, and the ureter that is from the lower sacroiliac joint to the bladder, it is called as the lower ureter. So you could see a radio density, radio opacity over the left side of the abdomen in an area of the lower ureter. So this is basically multiple lower ureteric calculi in this X-ray. So the diagnosis is it's a plain X-ray of the KUB region because you see the pubic symphysis and a PA view. Mind it, you always take a KUB region X-ray into a PA view. And there are radio dense shadows that are perivertebral in location near the lower rib and in the renal pelvis. So it's a condition is called as the X-ray KUB region. Next, this X-ray. So this is a plain X-ray or a contrast X-ray. I could appreciate radio density denser than the bone. I could appreciate in the various X-rays. So it's a contrast X-ray, serial X-ray of the KUB region, because you are able to appreciate the pubic symphysis but not the diaphragm. And you are able to appreciate some radio opaque shadow that is corresponds to the renal pelvis and the ureter. So these are the renal pelvis. You could see the contrast that is coming to the renal pelvis and going down. This is the ureter that is in the paravertebral location. You could appreciate this. You could appreciate, and the contrast reaching into the bladder. This is the bladder. You could see it becoming denser and denser with time. So there are time written. This is plain X-ray. Then this is the another X-ray. So this is a X-ray, something called as intravenous pylography. So you give some intravenous dye that is first absorbed by the arterial system, then it reaches the kidney, and through the kidney it is excreted into your KQB region, that is the pelvic calcium system. So then you take an X-ray and you visualize this pattern. So it's an intravenous pylography. So thank you, students. If you have any questions or any doubts, you can ask in the comment section. Thank you very much.